Hi, everyone. My name is Wei-Bing Chen, and I am the Deputy Director of the PDG B-5 TA Center. It is my privilege to welcome you to our annual convening Research to Practice Plenary and introduce our lineup of distinguished guest speakers. As you can probably guess from the Research to Practice in the name of the session, what we'd like to accomplish here is to lift up lessons learned from recent PDG B-5 evaluations in 3 states or jurisdictions that helped inform early childhood practice or policy in those places and could potentially be useful examples to learn from for those of you listening from elsewhere. These lessons come from research findings as well as from the experience of the research process itself. We are pleased to have with us 3 research teams today from Nebraska, Oregon, and the District of Columbia. The Nebraska team is represented by Kate Gallagher of the Buffett Early Childhood Institute at the University of Nebraska, Jolene Johnson of the University of Nebraska Medical Center, and Lisa Kanoki of the University of Nebraska, Lincoln. They will share what they have learned about systems building using a 3-tiered systems-focused evaluation framework. The Oregon team is represented by Beth Green of Portland State University and Catherine Pears of the Oregon Social Learning Center. They will share the successes and challenges of collecting data in an equitable way to inform the development of their state's early learning system. The team from DC consists of Celine Domitrovich of Georgetown University and Aurelia Gavins of MedStar Georgetown University Hospital. Hillary Robertson is also on their team, but she is unable to join us today. Celine and Aurelia will discuss what they learned from supporting the early care and education workforce to promote positive and equitable outcomes in children. We are honored to have Chantel Meek, Professor of Practice at Arizona State University and the founding director of the Children's Equity Project, join us to tie the presentations together using an equity lens. The Children's Equity Project works at the intersection of research and practice and policy and focuses on a range of equity issues in the early years as well as the early grades. Dr. Meek will share the framework she and her colleagues use to guide their pursuit of equity in child and family outcomes. Just so everyone knows what to expect, this is the format of our session. Each state team will have 20 minutes to speak, and Dr. Meek will then have 15 minutes to tie the presentations together, as well as share her work at the Children's Equity Project. And there will be 10 minutes for Q&A at the end with all of the presenters together. To ask questions, please use the chat function in the Zoom live stream. You are welcome to put in questions at any time, and our tech team will monitor the chat. Okay, so now I will turn it over to Kate from the Nebraska team.
Good afternoon, everyone. It's a privilege to meet with you today and to present with my colleagues on this panel about our learning in complex adaptive systems. We'll describe to you today pieces of our learning journey, which includes research to practice and practice to research perspectives. This is one definition of systems change that we've been using in our work, thinking about shifting conditions that hold problems in place. We have a lot of quotes that we turn to for inspiration in our work. And because in the context of messy systems transforming work, we need to constantly build ourselves and each other up. And we need to remember that the uncomfortable process of shifting, of change is hard and does lead to rather frequent tension. Today, we're going to share with you pieces of Nebraska's learning journey. We're here representing a cast of thousands. Okay, it's Nebraska hundreds, but the 3 of us represent different arms of the University of Nebraska, but our work extends to the Departments of Health and Human Services, who's our grant lead, the Department of Education, Nebraska Children and Families Foundation, who facilitate and coordinate our efforts, providing critical leadership, and many agency, university, and community partners who move the work. Many of our wins in our current work are dependent on the many quality early childhood structures and efforts in the state before receiving PDG Birth to 5 funds. We at the Buffett Institute lead several projects, and we're responsible for the strategic planning, leadership, needs assessment, and performance evaluation. I'll provide a very brief overview of our work in the planning and first years of our funded work, primarily from a performance evaluation perspective. A team from Monroe-Meyer Institute, led by Dr. Jolene Johnson, leads simultaneous learning experiences across the PDG projects to focus on supporting systems thinking applied to evaluation. Jolene's going to share some of those efforts. And long before PDG Birth to 5, Dr. Lisa Kanoki's been working with her team to develop, install, and implement quality early childhood coaching in the mixed delivery systems. We are really fortunate to have her expertise and leadership with coaching in the state, providing one example of how a powerful intervention can over time impact our practices, structures, relationships, and thinking such that early childhood systems experience transformational change. And I want to note in our efforts, Dr. Kirsten Kynes of UNC Chapel Hill has really served as a thought leader and partner, facilitator, and documentarian of the work we're doing. In the PDG Birth to 5 planning year, informed by existing and ongoing needs assessment, Nebraska worked across sectors and stakeholders to develop a strategic plan. And we landed on these goals aligned with the PDG Birth to 5 goals. The foundational goals, 3 and 4, focused on collaboration and alignment, provide the support for the goals for families, children, and professionals reflected in goals 1 and 2 around access and quality. It's worth noting that in our strategic plan, we've defined quality as a child's experience, or the degree to which a child experiences frequent, warm, one-on-one, language-rich interactions with a caring adult. Noting that what adults and programs provide are not quality in and of themselves, but provisions that we think will increase the likelihood of a child experiencing quality. While all the projects are designed to impact some aspect of the mixed delivery system, some of our foundational projects are designed to support system building efforts. So in our plan, an ongoing needs assessment informs and is informed by the strategic plan. Our performance evaluation doesn't evaluate individual project performance, but instead evaluates how projects are advancing the goals and objectives of the state strategic plan, and to build capacity at state and local levels to evaluate early child investments using a systems lens. And I'll say that establishing and installing feedback loops, represented ideally by those arrows, is one of our essential structural and process changes that we're focused on in these 3 projects. It is one of our bigger challenges. So rather than implement just one approach in our work, we've drawn on several research paradigms to inform our thinking and shared learning. One approach that's resonated with our team and has been really helpful in our learning and sharing with partners and stakeholders is thinking about how we're shifting our structures, relationships, and thinking. And by the way, we've noticed, and you probably have, that in the culture of doing, and early childhood has a strong tradition of doing more with less resources. In the culture of doing, it's hard to prioritize the creation of structures, the functioning relationships, and the shifting of thinking. We can think about the structural change as explicit, those things we see, observe, and document more easily. And PDG Birth to 5 funded work has allowed us to leverage learning about the system to influence policy, for example, in childcare subsidy. And real transformation occurs in the context of relationships among the people and roles in the system. These semi-explicit conditions can be observed and examined, but require more effort. In the context of the pandemic and leveraging funding from PDG Birth to 5, Nebraska partners leverage statewide relationships to initiate a comprehensive resource and referral system and to survey childcare providers to identify program, economic, and well-being needs. By the way, neither of these were initially planned and were responsive in the pandemic to what's needed. And key to sustained transformation is the changing of implicit mental models, which sometimes need deeper dives to observe and document. But without changing how people and communities think, we can't realize real change. Mental models are in fact thought to drive and sustain our ongoing change. So these mental models form and are formed by the language we use, discussions we have, and stories we tell. In our work in Nebraska, our mental model work has been manifest in our increased engagement around family engagement and equity conversations. So, from a performance evaluation perspective, we've been working with partners and stakeholders for a year to document project and state progress toward strategic plan goals, and to build our state's capacity to evaluate early childhood efforts using a system lens. Over a period of 7 months, we engaged monthly with 40 to 60 program and evaluation stakeholders and partners, intentionally invited to represent sectors, geographies, roles, power differences, and thoughts from different racial, ethnic, and cultural perspectives in our state. As a systemic community of practice and in the context of impressive virtual meeting practices, we gathered and consolidated program and evaluation stakeholders' ideas and conversations in a key learnings document. We first built on our state's values expressed in our state strategic plan, and we developed principles applied to our values, especially as related to evaluation. We then arrived on simultaneous consideration and elevation of quality and equity as a driver for our evaluation capacity building efforts. This we laid down as our bottom line, that we think about quality and equity together. By the way, we're committed to it, and it's still a process. And finally, and again with our systemic community of practice, we landed on a set of first steps that includes a priority for what we're calling equity action agendas. An equity action agenda is an intentional approach to engage a diverse set of stakeholders who will inform the design of evaluation so that the evaluation findings lead to actionable information to improve program quality and equity simultaneously. So I'm now going to turn it over to Jolene Johnson, who's going to share with you how we're working to take action on some of these ideas.
Thanks, Kate. That was a lot of information in a short amount of time because we have been busy in Nebraska. So thank you for sharing all of that. So the role of University of Nebraska Medical Center, and particularly MMI, was really to how do we make performance evaluation accessible? And we're doing that in a couple of ways. Really to build the capacity of programs and other local evaluators. And we're trying to do this at two levels. So how do we help local evaluators and local programs first learn to how to evaluate their own program? So ask about, is your program effective? Who do you want to reach? But then help them develop systems level thinking as far as how does their project impact the bigger system? What type of questions should we ask? What type of data are out there? How does the logic model fit in? So that's kind of a big one as far as how do we build capacity on two levels. The second piece of this is part of a sustainability challenge for the state. And that is building a toolkit around evaluation based on what Kate was talking about, those values and principles that were established by that evaluation network team. So at the end of this grant, there should be a toolkit of methods that we've used, stakeholder input, all kinds of different things that local evaluators, programs, statewide systems could have access to. So again, making this evaluation accessible to programs and evaluators. So TA provided so far, we really started with some concrete pieces for programs. And each program and project that was funded by PDG was asked to attend a webinar. The webinar focused on data utilization and logic models. Data utilization really dove into what data are you collecting? What's it useful for? What's the story you want to tell with your data? What is that story? How are you going to tell that? How are you going to give that feedback back to parents? What kind of feedback do parents want? What kind of feedback do board members want? Do policymakers want? So how do you use that data to impact those different levels of a system? The next piece was on logic models. And we really focused just on core components of logic models. What's going into your program? What are the outputs you want to see? What are some things that you hope happen because of your project? And we started these logic models focused on the project itself, so individual projects. What are they hoping to accomplish with their project? The second piece then is to take it a step further and then think about, okay, so if you're talking about your project, how can you embed some of these values and principles that we've talked about as far as the equity action agenda and as part of the evaluation network team? So embedding some different pieces, some newer thinking into the logic models. After the webinars, projects had the opportunity for one-on-one TA with a member from our team to really flesh out their logic models, to put a draft together, to start thinking about evaluation questions. And based on the work that we did with projects, progress reports, different things, we realized we maybe needed to change some of our language around logic models and start thinking about them in a slightly different way and make them a little more accessible. I mean, we think about, everybody kind of walks around with a logic model in your head about how things work, how the world operates. And so we really wanted to try to make it more concrete and more accessible for our programs. And so we're really focusing on these logic models as tools, things that are formative, things that can change over time, And you can see here what we're putting there, how change happens. What are we doing to produce change? What changes we might produce based on our program? And again, these are 2 steps. We're looking at it at the project level and then again at the big state level. So we have logic models for quality. We have a logic model for access. And in those, we're thinking about how do all of these projects come together and move the system forward? What does that look like? And how do projects see themselves within these larger logic models? So what we've learned so far is that when projects started, many of them did not have an evaluation plan or logic model before they started delivering services. People were excited to get started. They were like, we think we have a great idea. Let's get going, which is great. And I think sometimes what we want to say is, you know what, programming is most important. We don't want logic models to be the thing, but we do need the help, have them help organize sometimes our thinking. And so part of our TA was like, how do we provide support around developing these logic models? The second piece, and you might see this too, is it was difficult sometimes for projects to see how they fit into the overall system. How could they help move that system forward? What is their piece in the sustainability? So part of our job is to help create those connections, help them see how they fit into the bigger network. And then finally, and I think Kate mentioned this, is our evaluators and program staff are saying, hey, we need to develop these evaluation plans with more than just the evaluation team. We need to have more voices at the table, input from stakeholders. And so that we've made a really intentional effort to do so. So next steps for this year is we have established an advisory council for the evaluation network team. And this advisory council is a very diverse group made up of different lived experiences. It's very racially and ethnically diverse. It's very diverse by role. We have people who are directors, we have people who are funders, we have people who are evaluators coming really in to tell us, hey, here's what's going well, here's what's missing, here's some input on your evaluation plans. We're going to continue TA on logic models, evaluation plans, and then measurement. We've been holding off a little bit on measurement, really trying to solidify more of the thinking around, what do you want to know about your project? What do we need to know as far as how the state is moving forward? Sometimes people are very content to just select a measure because it's there and it's what's been used instead of some of these preliminary steps. And then finally this year, we are going to pilot some projects and some evaluation practices using the values and principles that were developed last year from the evaluation network team.
Thanks, Jolene. I'll take it from here. Happy to have the chance today to highlight a project that we've been working on at the state level and show kind of how this is playing out in one particular project. And I think it's the experiences and lessons that Jolene provided are certainly ones that we've experienced. So Getting Ready is a family engagement approach, evidence-based for early childhood programs. It's designed for use in home visiting and center-based programs serving children and families birth to 5. It's characterized by 8 strategies in a collaborative structure used by early childhood educators to promote partnership and collaboration, certainly focused on child outcomes. It is a relationship-based approach, and the website is provided there if you'd like additional information. It really is a professional development approach that's been installed within currently operating programs. So it is not a standalone, it is something that is embedded within early childhood programs. We have been building the evidence base, as Kate indicated, for Getting Ready for quite some time. And so we've had an opportunity to implement and evaluate this approach at the University of Nebraska-Lincoln over several years. And so we have built a solid evidence base through randomized trials. We've worked in very close partnership with programs in Nebraska and neighboring states, and have really used evidence to improve the intervention package, iterate on what we've learned. Through this process, we've made some significant relationships with stakeholders across the state. They've really been instrumental in this work. We have approached our work through a research practice partnership type of approach, and we've benefited from federal funding for establishing this evidence base. And so this is a unique opportunity to fold it into the preschool development grant funding to roll it out in a broader way across the state. So we're specifically aligned with goal 2 of the Nebraska Early Childhood Strategic Plan, which is focused on quality. Kate provided that definition earlier. And specifically, we're focused on promoting the provision of quality through improved family engagement practices. We are training early childhood educators and building an infrastructure for ongoing support and implementation of the Getting Ready approach to support family engagement. We are now having an opportunity to focus on system change and think about how the work can be sustained within the developing PDG birth to 5 infrastructure. The work aligns with the needs assessment. So all of this is really exciting, and it's helping us to think beyond our specific project and think about how Getting Ready aligns with this larger systems level frame. So specifically, when we think about how we've aligned with the systems level evaluation, as an individual project, we have engaged in the Nebraska Evaluation Network team that work to develop those values and principles that both Jillian and Kate mentioned. We developed and shared a logic model of our programmatic activities and the related evaluation efforts. So we're feeding into the developing systems level evaluation work. And we share a report of our outcomes to stakeholders to again inform the systems level efforts. So it's really an opportunity to think beyond our project specifically and really think about how we're aligned and fitting within a larger system. And that has been a new opportunity for us as a project. So we do have some challenges and opportunities for the future. I think it really is both a challenge and an opportunity. One is reconciling our targeted outcomes for the project at kind of a micro level that focuses on children's learning and development, on parent-child relationships, and on parent-educator partnerships with the outcomes of the systems level evaluation work, those values and principles that are focused on family engagement, equity, and quality. And it's certainly not the case that those aren't priority areas for us in our intervention work. And we are certainly well positioned to align with the priority of family engagement. But the focus on equity and quality is something that very much aligns with Getting Ready in our approach, but it's just not something that's traditionally been a targeted outcome of Getting Ready. So we believe this approach very much supports equity and gives educator strategies to engage with all families they serve, but we have not intentionally targeted equity as an outcome to this point. So involvement in the systems level work is really informing our thinking and bringing family voice into our evaluation work, are ways that the systems level work is interfacing with our work as an individual project. So I think Kate's going to wrap here with some key takeaways.
We're going to show you our takeaways, and our time is up. So stakeholder voice, not about us without us, relationships, 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 and expect the unexpected, thrive and grow in the messiness. And thank you so much. Last slide, Lisa. And we turn it over to our colleagues at Oregon. Catherine, take it away. Thank you, everybody.
Good afternoon, everyone. Thank you for having us here today. I'm here with my colleague, Beth Green, who is the director at the Center of Improvement of Child and Family Services at the Portland State University. I'm Catherine Payers, I'm the science director at OSLC Developments Incorporated, and we've both had the pleasure of being involved with the Oregon Department of Education Early Learning Division as part of the Birth Through 5 Preschool Development Grant. As Kate alluded in the last session, these grants are huge and take a cast of thousands. So today we're going to be focusing pretty narrowly on the goals and priorities for Oregon's Birth Through 5 needs assessment that we provided at the beginning of the project. We're using this to specifically focus on the goal of Oregon to really be able to elevate and center the voices of populations that have been traditionally minoritized or aren't usually heard using our common research methods. And so we're going to talk about what challenges and opportunities we found during our work for really understanding the racial and other inequities that exist in our state in terms of access to and experiences with opportunities across the early learning system, and how we have seen those challenges in a variety of contexts in terms of research, and that's in using administrative data, in conducting community surveys, and in listening to families themselves and elevating their voices. So to talk about the goal of Oregon's, one of the main goals of Oregon's B-5 PDG grant overall was to collect and use data on the strengths and needs of the early childhood system in order to be able to inform statewide and local plans for improving and expanding the opportunities throughout the early learning system. Oregon has been going through historic investments in pre-K, public pre-K funding, as well as in trying to expand statewide state-funded care to infants and toddlers. So there was much room for using this information. In particular, the early learning hubs are regional groups that are made up of 1 to 4 counties that are responsible for administering a lot of the programs that are offered to children and families with children from birth to 3 in the state. And so one of the key users of this data were going to be these early learning hubs, so that they could begin to really identify the priority populations who might have been left out of previous programming and funding, and the geographic areas, so that services could be expansively moved into those areas. The Oregon Early Learning Division also really wanted to prioritize data that would strengthen the equity in their work, and do this by being able to disaggregate quantitative data by race and ethnicity, and language and other geography and other factors, in order to really deepen their understanding of the needs and strengths of families that are not part of the dominant culture, who have traditionally been marginalized, or who may not receive the services they need, say, for their children who are experiencing developmental disabilities and chronic medical needs, and to really find multiple perspectives within this data, or to expand the data so that these multiple perspectives could be heard. So we want to begin, as we will end, with our key takeaways, and we'll talk about these as we talk about 3 very specific projects that we've done as part of the needs assessment. But the first key takeaway in being able to do this work is really to focus on the priority populations and be able to identify these populations, and know who it is that we haven't heard from, and be able to really focus on centering and elevating their voices. The next main point is that even without the dumpster fire of COVID, we always needed flexible planning, but that continued even when we did enter into the COVID age. But the idea that we need to allow time to meet with the agencies that work in and among the priority populations, as well as time to build trust, and to even go back and check the data with those populations, and make sure that what we are carrying forward as the findings are also how those groups view what should be elevated. And then finally, to build partnerships, and that's in all sorts of between all sorts of partners, between the state, between the research partners, between the research partners and the community agencies that worked with the populations that we wanted to hear from, and certainly to build partnerships with the families themselves in really trying to represent their voices in an authentic manner. I'm going to pass the baton to Beth, who's going to talk now about the first project, the first component of our project.
Right, thank you, Catherine. And apologies for slide back and forth. That's all me. So Catherine has nothing to do with that. I'm going to talk a little bit about the first piece of work that we did around in response to the state's request for more data to help with their planning needs. And they really were initially focused on the fact that they had a lot of existing administrative data that described the needs and characteristics of Oregon communities across the state, but there is no systematic database that brings all these together. And our early learning system is challenged by a lack of an early learning system database as well. So what we wanted to do was to try to bring together a variety of different kinds of data that could really help the early learning hubs and the state to really help identify those communities and those both regionally and within counties and within really, really localized micro communities such as community elementary school census tracts and things like that, to help identify strengths and needs. And as we started talking with the state, we really were pushing them to think about, how can we make this information something that is not a big fat paper report needs assessment that people look at, people submit to the federal government and say, hey, I'm done, but could be something that would actually be sustainable and useful for multiple partners for planning early childhood and other kinds of investments. So what we did in the first phase of our work was, after spending considerable time and effort identifying and compiling data from across multiple state agency sources, census information, health data, childcare data, variety of different data sets, we created and worked with a programmer to create an interactive map of Oregon that could be accessible to a variety of different state agencies and partners. And I'm just going to give you a quick view of our what we call our ELMO database, which is the Early Learning Map of Oregon. We were very happy with our title too. So we spent, I would say, upwards of 6 to 9 months just compiling data from across our different partners, and then worked with, we were lucky enough to find an absolutely fantastic web programmer and created ELMO. And I'm just going to give you a really quick tour. The link is accessible and we can share it after the session. And worked with our community stakeholder advisory group to create a data set that would be useful for them. The map is like these kind of interactive maps, something that allows people to pick different indicators. And we have about 120 indicators of different factors related to community and child characteristics, program type and capacity, so they can look and see what kinds of programs are in their communities, what the characteristics of those programs are. We have information about the early care and education workforce, the types of providers, the numbers of providers. We have a number of family strength and resiliency factors, and then we have some outcomes related to school readiness and early school success that are linked to our state strategic plan. And then within that, our goal was really to try to disaggregate by race and ethnicity and by age as much as possible, so that people could really start to understand needs of specific populations. And the map is mappable to a variety of different regions specific to Oregon, all the way down to census tracts. And so you can pick which maps you want to look at and so forth. I'm not going to show you any more of the map. And then we did a variety of trainings across the state to teach people how to use the map for their planning purposes within the early learning field specifically. Now my screen appears to be frozen. There we go. All right, so developing this new map was no small feat, as I said, because of all the different ways that the data are put together across different state agencies and different partners. But we really did use and develop a broad number of partnerships to access and include the data in the map. We had a partnership with our map developer, who was just amazingly responsive. And then we did a lot of outreach to build excitement and readiness for rolling out ELMO to the community level policy and plan makers and planners. However, we found that despite our absolute desire to disaggregate information, by priority populations and race, ethnicity, and age, that data, as you may not be surprised to learn, is just not very accessible. Like a lot of databases do not break things down the way that you might want in terms of race, ethnicity. They break it down in different ways. So lots of information was lost and a lot of detail that people wanted. So we really had to work to add some additional kinds of information in order to really speak to the state's mission and goal of framing, planning, and policy and program expansion around using an equity lens. Okay, so that was step one. And now I'm going to turn to Catherine to talk about one of the ways we tried to move that forward. You're muted, Catherine.
Thank you. As Beth noted, one of the things that was true about the administrative data was that it was hard to disaggregate on into the populations of interest. And also it didn't tell us very much about what the needs and preferences and experiences of those families were in terms of getting care and selecting care. So the next move was to have a household survey in which we really could drill down on the childcare needs and preferences of families, their challenges to finding care, the experiences with suspension and expulsion, which is an ever increasing number of children. And then as we were into the COVID pandemic by that point, their experiences of disruption of care and their preferences in the light of COVID-19. And what we were interested in doing was in particular to hear from families of color, those who had home languages other than English, and those with children who were experiencing developmental disabilities or chronic medical needs. And in our planning, we had made a plan to oversample these priority populations using typical sampling strategies. And we had in fact hired an independent agency who was going to do random digit dialing to locate those families. And we found out very quickly that that was not a successful way to go about trying to sample families at all. So as we tended to pivot, can we go back to the next? Yeah, as we learned how to pivot very quickly in our planning, as I said, and revise it and be flexible, we very quickly turned to talking to community agencies and building upon partnerships that we already had extant, but also reaching to new community partners and new community agencies in order to get the word out about the survey. So we actually simply asked them to give the link to families and have families fill out the survey. And our success, it turned out that that was in fact a good pivot, because we were able to get a statewide sample that was actually quite representative of the priority population. So again, going through partnerships with trusted community agencies allowed us to really reach out to those families from whom we wanted to hear, and sending out the message that their voice was important and that we wanted to hear from them got them to actually respond to the survey. And that data then helped us really inform some of the key questions that the state had about these priority populations. In particular, we found out that parents of color felt extremely challenged in finding culturally and or linguistically responsive care for their children. And that would have been hidden had we not done disaggregation of the data and really broken down the data around different groups to understand what the barriers to finding childcare were. And then in March of 2021, as folks were returning to childcare and we were asking, the state was particularly interested in what kinds of preferences families now had. We found that BIPOC parents were much more likely to express concern about their child or family contracting COVID-19 from childcare, and that was driving a really very strong and marked preference to have in-home care as opposed to having their children in out-of-home care. In terms of challenges, we did find that it was still very challenging to recruit some particular priority populations. In particular, using a white dominant sort of research timeline, we didn't have enough time to have authentic engagement of Native American and Alaskan Native communities. And we also found that we were sort of stepping on other surveys that were being planned around the state. So we really needed to do better communication with our partners about duplication and multiple requests for survey filling out. So our next step was to take this one step further and try to figure out a more authentic way of getting family voices. And I'm going to pass it back to Beth.
Great, thank you. All right, so our third phase in terms of digging down and really trying to elevate the voices of especially marginalized communities, as well as families with young children, was to do a series of family focus groups. We work with the state to ask the question, who do you feel like you haven't heard from in the research that you've had to date? They identified a number of different specific populations that you see there: refugee families, Native American, Alaskan Native, Latino families, and Black families, as well as African American or African refugee families, and then families with children experiencing developmental disabilities or chronic medical needs. To do this work, we really intentionally developed some critical partnerships. First, we realized we couldn't do this work effectively without someone who already had some existing relationships with some of these communities. So we engaged a bilingual bicultural research partner who had extensive experience working with both the Hispanic Latino population as well as the Native American population. Then we reached out to really do co-creation of the focus groups and the focus group plannings with a series of culturally based organizations, and especially with culturally specific organizations that already had deep connections with these families. We try to recognize their participation by providing the organizations with stipends, and really work to do a collaborative process of developing protocols, interpreting data, providing copies of findings for their input, and making sure their questions were addressed as well. So some of our successes there were just really this idea of, if you want to intentionally find families, especially families who do not fill out surveys for the most part and often don't show up in administrative data, working with these culturally based community organizations was really critical. Planning, Catherine mentioned, sort of being in alignment with our team, was being driven by the state and the federal government to respond to timelines that just really don't work well when trying to work with these marginalized populations who have an ongoing history of being used and not having their data shared by white mainstream culture and universities. We did, however, get a lot of information from parents by specifically asking them questions about their experiences finding culturally and linguistically responsive care. We asked specifically questions about experiences of racism and discrimination in childcare, when they did not feel welcome, when they felt their child was treated differently from other children. So we really did learn a lot of information by asking specific questions of the parents. More time is out. Families experience multiple stressors, not surprisingly, during COVID-19, as well as told us stories about the ongoing multiple traumas they were experiencing over the past year, with systemic racism relating to some of the events that we are all familiar with in terms of the death of George Floyd, resulting protests, and the turmoil politically, nationally, and in the state of Oregon. And also heard a lot of BIPOC parents saying they just really didn't feel safe putting their children in care because of all the racial turmoil that was happening at the time. In terms of challenges, Catherine mentioned same challenges showing up over and over again, just having to be flexible and really changing our strategies. I'm sure everyone who was doing research during COVID has had this experience, but really trying to figure out how to do it and change our plans accordingly. And then really, again, still a need for more planning time, especially with our Native American, Alaskan Native communities. It was just really challenging to spend the time needed to develop enough trust that we could effectively engage as many families from those communities as we had wanted to. All right, so just a few lessons learned, because I feel like we're probably just about out of time. And these resonate with, I think, some of the lessons from Nebraska as well, as that is to really elevate the voices of the BIPOC communities and communities that have been pushed to the margins and not listened to and not had the experience of having their experiences brought forward. Just really takes time and really takes intentionality. that we really had to be very strategic in our planning, but constantly revisiting our plans. So planning was critical, but plans had to be responsive to ongoing changes. And then, not surprisingly, this idea of having partnerships and having a history of partnerships, both Catherine's organization as well as our team at Portland State, both with the state folks that we were working with, so we could really engage with them deeply and regularly in planning work, as well as with our early learning community hubs and community-based organizations across the state, really was critical, as well as developing new partnerships that we realized we needed to in order to do the work well. And I'm going to pass it over to Celine from the Washington, D.C. team.
Thrilled to, let's see, is that going? There we go. Really, I've enjoyed these presentations before. Ours, so interesting. Wish we could just sit and talk about shared experiences. We're not able to present on everything today, but some of our other areas of work, really what you were talking about resonates with us too. So the research practice partnership we're going to be presenting on today is based in Washington, D.C., and it's between the Early Childhood Innovation Network and the District of Columbia's Office of the State Superintendent of Education, OSSE. So one of my EASN colleagues, Aurelia Gavins, is on the panel with me today, and all of the others listed here on the slide have been involved in various ways over the years in this collaboration. Because our collaboration really started quite a while back. It was not just limited to the preschool development grant Birth to 5. So, but we're going to focus on that phase of it. So our goal today is to illustrate the benefits and lessons learned in that phase of our partnership with OSSE that took place during the grant, when we served as both a program partner and as the evaluator of that work. But the partnership really began in 2015, back when our co-directors of EASN, Lee Beers, a pediatrician at Children's National Hospital, and Matt Beal, head of child and adolescent psychiatry at Georgetown, were part of a cross-sector work group that was designing a systemic approach to child health, development, education, and well-being. And what you see in this slide that represents that systemic model up in the upper right-hand corner is the mission of the district's systemic work at that time. And it was to improve outcomes for children aged birth to 5 by addressing racial and social inequities in DC. And the arms and legs of the teddy bear is the illustration of the plan, involved building a shared commitment, engaging in collective action, and sustaining action for the long term. So I just wanted to show that the partnership phase of PDG Birth to 5 dropped into a long history and exciting systemic work that was already happening in the district and we were involved in. And that's going to be one of the take homes of these kinds of partnerships, I think, and how they can be most effective when they're in the context of a much longer term commitment to one another. But before we go into any more details, I'm going to pass it over to Aurelia to tell you just a bit more about EASN and the way in which we work.
Thank you so much, Celine. Just to give you some background on the Early Childhood Innovation Network, we are a community-based research practice partnership designed to really support the mental health and wellness and systems change throughout the District of Columbia. We are a network made of multiple partners, community-based organizations, family-run organizations, and various stakeholders in the district, where we've come together to really look at health, mental health, wellness, education, and particularly looking at multi-generational mental health of young children and their families and providers, with a deeper dive into trauma and toxic stress. So just to highlight a few of the goals, we want to keep families well, we want to protect and enhance caregiver mental health and wellness. We want to really strive at building babies' brains and optimizing the developmental outcomes during the first 5 years of life, and just really want children to be ready for school and ready to learn and ready to grow in their development. One of the things that was really successful for our partnership was that our goals was really aligned with the district's goals. And so we were able to establish the partnership for optimal success. And so we dive deep into trauma because, as you can see here on the slide, the District of Columbia has a higher, national level of ACEs than Maryland and the nation. And so we dive deeper into that trauma work. And just really looking at those rates of adverse experiences of children. And so we want to be focusing in on trauma responsive care and supporting children in those areas. Another thing that has come up for us and many of you, just the impact and the increase on trauma and wellness just due to the disparities and the impact of COVID-19. So, we've been able to really look at not just the trauma in itself, but start to dive deeper into the social and racial injustice and inequities at the forefront of public health throughout the pandemic. And so this data here just kind of highlights from the Rapid EC project, who conducted a survey on the well-being of US households and young children on a weekly basis since April 2020, looking at how COVID has impacted families. And what we can see is that the inequity gaps based on income and health has widened greatly throughout this time. And that just leads us back to the Early Childhood Innovations Network focus on and high priority on promoting racial equity. And our mission has been to really eliminate the disparities that impact young children, particularly those related to health, mental health, trauma, and toxic stress. And EASN began our work about 5 years ago, really starting to have dialogue about how we can become a more diverse, equitable, inclusion, and anti-racist organization. And this has had a significant impact on the way that we do our work and intentionality of the co-creation in our work with our community partners. In some ways that EASN does this is that we really want to embed racial equity into our structure. So as we create and co-create with our partners innovations, we're continually looking at anti-racist and racial equity goals, and how we can be a support for system accountability. We also focus in on continuous learning, where we have anti-racist learning communities across the network, racial equity community practice, and really focusing in on having a liberation psychology training hub for both our clinicians and community members. We also promote equity and racial equity through our development and our research and our dissemination work. We dive deep into co-creation with our stakeholders, families, and communities. We have a community-based participatory research methods that we utilize as we do this work. And we really emphasize anti-racism principles in our innovations. So when we're thinking about things like workforce and looking at that, we're not just looking at it from this current system, we're looking at it from both a historical lens and seeing how racial inequities have impacted that work. And so we do that in many ways. If we're looking at workforce development or workforce compensation, we know that in 1963, President Kennedy, said there was equal work for equal pay of equal value. So if our mission is to build babies' brains, we want to promote equitable pay for infant toddler teachers and our family child care home providers, because we know that building brains is work of equal value.
Amen, Aurelia. Thank you. I wanted to build upon what Aurelia was telling you about in terms of our approach to the work. Then, of course, we're looking at the research and making decisions and about where to put our efforts. And another place of alignment was the fact that both we, EASN and OSSI, even though we were focused on families with young children, we were very concerned about infants and toddlers. And that's really important from an equity standpoint, given the research on the detrimental effects of trauma and adversity on the very youngest children's brains, their physical health, their cognitive and social emotional functioning, and just understanding how those experiences of trauma also by caregivers, say maternal experiences, can undermine parent-child interactions, attachment quality, and then that's going to have an impact on children's behavior. So this intervening very early was always a priority that we shared with the district. We also shared an interest in the workforce, and it was exciting to see that we could complement the other panels by really talking more about our workforce side of the work, even though we shared similarities with you all on the family work that we did in PDG Birth to 5. But given that a significant proportion of children growing up, especially in low resource families, will spend time in the care of others, we have to address the needs of the adults that care for young children if we're going to have an impact on the children's outcomes. And of course, this means then the early care and education workforce. So the research that was driving our work, and some of this done by some of you on the panel, was really examining what we know about the effects of teacher mental health and well-being for early childhood education quality and child outcomes. This research body is growing rapidly. There aren't a lot of evidence-based randomized clinical trial studies of interventions, but there's a growing body of research, basic research on these factors and about the both individual and systemic or organizational program level factors that impact this workforce. And as Aurelia said, teaching is already a very stressful profession, but we know that for those that are underpaid, especially in the infant toddler sector of the workforce, this is very stressful and an added burden that impacts their stress, burnout, and mental health. So also depending on the needs of families and the context, the setting where they're working, there's a high potential for secondary trauma in the workforce. And the positive news is that we know there are supports that can counter this. There's important upstream policies and solutions, like Aurelia said, about actual pay that we need to address. But in terms of coping and supports to teachers, mental health consultation and other SEL supports are clearly important things that we can do right now to support the workforce. So this was the research context that we were working with OSSI on, and it informed their logic model of their PDG Birth to 5 approach. And what I wanted to highlight, what we thought we would highlight today for you were these two categories of benefits of the work that we had the 1-year planning grant. We did not have the subsequent grant. So this is a lot to do in a year, but we're quite proud of our partnership and what we were able to accomplish. We could bucket these successes, I think, into two categories. We felt like there was supplemental data collection, similar to some of what you all did, that we were able to do through the partnership and with the PDG Birth to 5 funding. And we were also able to develop some and prototype, do some piloting of some innovative support strategies that I'll be telling you a bit more about these two categories of work. But before I dive into that, I thought I should just give you a big picture view of the mixed delivery system in the district. At the infant toddler level, we have licensed early care and education programs and early Head Start, of course, delivered through community settings and DC public schools. The settings that offer subsidies are required to participate in our capital quality, the quality rating improvement system for the district. The district also has a early Head Start childcare partnership grant, which includes a network of centers referred to as the Quality Improvement Network. And we work closely with them during the grant. Then, of course, there's also the federally funded and local home visiting programs. District has universal pre-K, and that operates in community-based settings, DCPS schools and charter schools. These all also participate in capital quality. So the two supplemental data collections that happened that we wanted to share with you all today The first was the measure of facility climate that was in the logic model of the PDG B-5 district's logic model. They wanted to use this measure, formerly called the Early Education Essentials, now called the Essentials. This was developed by the Ounce of Prevention, and it is a measure of organizational capacity that at the preschool level at the time had been validated to link to program quality. And we wanted to, the district thought it would be really helpful to gather this data within the district. So we did collect this in the Quinn. But the other thing that was exciting about during this time and through our partnership is that we were able to serve as a research site for the similar validation work at the infant toddler level. So they were developing their downward extension of this survey. This is a parent and staff survey for anyone who's not familiar with the essentials. And we were able to provide them with data from infant toddler programs that has now enabled them to do their validation across the 0 to 5, birth to 5 spectrum. So the measure now covers that full period. The other supplemental data collection that we were able to do was collecting an online survey of workplace characteristics, supports, and physical and psychological well-being of early education providers. This was a source of data that was not collected universally by the district, but really turned out to be, so it was new, but also very, very useful because of this interest of both us and OSSI around workforce well-being. So the study was conducted pre-COVID, but it was COVID that shut down our survey because it got to the point where if we kept going, we were really combining data with obviously the pandemic being a huge source of stress, that we thought better to close it and have a distinct period of time where we would study the effects of COVID after this. So we did not end up getting as big a sample. I mean, we were striving for a touch point with every member of the workforce. It was a small sample of 174 participants, but we felt it was small but mighty. We were pleased to at least have the data, and it was well representative of the mixed delivery system. So it wasn't skewed to one setting or another, or one developmental level or another. So we were pleased about that. And we know we're going to replicate this. So we thought, though, that it was an important first source of information. And we were able to do 2 sets of analyses that really turned out, we think, to be helpful, idea generating, and informative about the workforce. And the first set of analyses were structural equation models, where we wanted to first of all replicate this well-established fact that job demands can promote distress when high demands and low control is the nature of the work as experienced by the educator. And so we did that. We replicated that, and we had a quite a varied, our distress measure tapped into several different indicators of stress. But what we really wanted to understand was what moderates this. We wanted to understand if there were certain members of the workforce affected differently, or if there were certain factors that were protective factors, moderating it and making that effect less intense. And what we found was that resilience, self-reported resilience by the members of the workforce, those who had higher levels of resilience, were not experiencing as much distress in the context of these kinds of work demands. And we also found that the relationship between demands and distress were worse for younger teachers. So that was also an interesting finding that we wanted to take into consideration, and OSSI could take into consideration with their planning. Again, obviously having to be replicated. We also were very concerned, we weren't surprised, but that there was actually a group of teachers, 20 to 25%, that were experiencing economic hardship. 3 or more indicators of hardship as defined by Whitaker's and Roberts' survey. We used the same survey and showed that there's food insecurity and housing insecurity in our early care and education workforce, and that worsened the stress level experienced by the educators. So important issues that we knew from the broader research, but that were very present in our local setting. And the second set of analyses just was about another positive factor, that a protective factor, which was that the social emotional learning supports, which included behavioral support in the classroom and consultation, really was very helpful for teachers, but especially for teachers who were older. So some interesting findings locally that that we've continued to use now and think about and apply in some of the grants that we are doing in collaboration with OSSI. So just to tell you then, so those were the supplemental data collection that we did. In terms of the development of supports, we, our colleagues at the Center for Child and Human Development at Georgetown had a model of trauma-informed practice, and they were able to conduct trainings and technical assistance with support providers in the mixed delivery system. They had the initial training, and then they did 3 communities of practice. It was exciting to see those of you on the panel that are also using community of practice. This has been, we think, an important structure for promoting peer learning and an exchange, and we've carried it into, again, in our current grants that we're writing it as a delivery structure. And this was very successful, and the participants liked this, felt it was very relevant, wanted the trauma-informed care guidance, and they also felt that we needed policy changes to support staff self-care. So through this process, we also learned about the needs around well-being and supports. The second innovation, support innovation that we developed with the PDG B-5 funding was an online teacher well-being course. The Department of Psychiatry at MedStar Georgetown, faculty members there had developed a workbook, and they were using it in person prior to the pandemic. But what we did was we translated that workbook onto this online system, and we have this 3.5-hour course that covers comprehensively well-being. And this was a tremendous resource to come out of this, and we hope to, we're going to leverage this in our future work. So just in terms, I have about 1 minute left. I might go 1 minute over, but just to tell you about our lessons learned, I think I alluded to these as we went through the slides, but there's realities about institutions and partnerships, red tape, things it takes to get the work set up or to get the structure set up to do the work, right? Data sharing agreements and IRBs and things like that. And so timelines, when they're short, if you think it's going to be just a year, like it's just very hard, right, to do this work. It seems like everybody was probably leveraging existing partnerships, and that when you have that and you're committed to the long term, you can have a stronger partnership, and you're probably more likely to do work that actually addresses genuine needs and is sustainable. And that's really a point that our OSSI partner brought up, and we both agreed that was truly, we felt, the case in our situation. I think the other thing that when Aurelia and I were thinking about ESON and our unique structure, research practice partnerships that are interdisciplinary, that allow for multiple perspectives. This is what we are proud of about our network, and we see that we have representation from policymakers, from researchers, from community partners, and especially from families in our network. So we feel like ESON is a broader partner than just, it's not limited, it's not Children's or Georgetown. It is a huge network with great resource and strength of history, of partnership, of knowledge of community members who have been doing this work way longer than us. And we would not be who we are without the strength in that network and numbers. So I think that thinking for those of you who are attending this panel about partnership, when you can partner with an entity that has that network, it's what maybe Oregon you found when you went to the partners that are trusted to push out the survey. That's what's built into a network like ours. And the last couple points were just that really you can do innovative and new things through these kinds of partnerships because they might be smaller scale. You can pivot maybe, like you said, more easily. And the important thing to keep in mind is you never know what that investment is going to reap. And in our case, an investment at one stage, even though we didn't get a subsequent grant, everything that we did together enabled us to apply for a Head Start University Research partnership grant that came out on teacher well-being. And you can just see in the outline of our model, we're excited because this is going to be an implementation study and an RCT, but the three components of our intervention model, two of them were developed in the context of the PDG Birth to 5 work. And the other one was other early Head Start partnership that we had, a group format of teacher well-being groups. And we were able to put them all together and leverage what we did and really work in a sustainability plan so that this is not just a big grant that comes and goes, but will hopefully make real systems change because we are a smaller state, right? We're a smaller DC and we're working with 3 of the largest providers. So the impact that our partnership hopefully will result from our partnership and this continued work will hopefully be quite significant, and we're excited for that. So I'm going to turn it back over to Wei Bing now, and just thank you all for your ears, and look forward to discussion.
Great, thank you so much to all of our presenting states and jurisdictions. And I'm actually going to give the rest of our time to Dr. Meek to do our wrap up, essentially. So she's going to tie the presentations together and share a little bit about her own work.
Thank you. So I'm Chantel Meek. I'm a professor of practice and the founding director of the Children's Equity Project at Arizona State University. Tell you just a super quick synopsis of the CEP. We are a national think tank really housed at Arizona State University and led with partners across the United States at several different universities across the country, really working exclusively on advancing equity in child serving systems with really an emphasis on the early care and education system through research, policy, and practice. So I'm going to talk a little bit about our kind of thinking about the 3 presentations and the great state work that we just heard about, and kind of sit back and think about equity at a higher level, how we think about equity with respect to early care and education systems, but with some level of specificity, I think, to kind of help tie some of these pieces together. So in December of last year, the Children's Equity Project, in partnership with a whole bunch of national organizations, published a report that really kind of identified a whole number of priority areas that we could implement policy changes from Congress, federal agencies, and states to really advance equity across the system. And as part of that work, we started by kind of trying to frame what we saw as an equitable system, and to then move forward on how to advance it and defining the different pieces of that. So I'm just going to read this quickly, but we kind of defined it and conceptualized it as an equitable system really having 3 overall components, really providing access to resources and opportunities and experiences to children and families that result in positive outcomes that are not associated with children's demographic characteristics. They actively and continuously identify and intentionally eliminate manifestations of systemic racism and other forms of oppression. So we think about that and kind of how we think about an equitable system. Those 3 points that we really emphasize and do deep work in, which we heard some of that today, is access. So who gets in the door, who has lots of barriers before they could get in the door, who doesn't get to get in the door at all. So access. The second piece is really experiences. So what are kids and families' experiences once they are in the systems that we are overseeing, that we're working in? And then the final piece is outcomes. And how are we measuring outcomes? How are we being accountable? And how are systems leaders really being accountable to not only promoting development and school readiness in general, but to really identifying and being clear where there are disparities and closing those disparities. So really, kind of as some folks have said, disrupting that link between demography and destiny, really getting rid of that association that we see there. And then there's the process, right? Process equity that we heard a lot about today, particularly with the DC model here at the end, but across all three of them. So here, digging just a little bit deeper on the three pieces. If you take a look at the report, and we can share the link with you, there under each one of these, we provide kind of several more specific policies to think about, many of which we heard today. So when we think about access, right, that first piece of who gets in the door, not just looking generally and at a national level, right, but at your state level, looking at the community level, looking at the program level, looking at who has more neighborhood access to these programs and who has to go further, looking at all of these different types of barriers. And I think, Oregon, I think, for example, having that really a stated part of that needs assessment be finding those priority populations, and that being a central goal of how that's driving it is, I think, a really good example of thinking about equitable access and who aren't we reaching and how do we get there. You heard some of that in Nebraska as well with their conversation. When we think about experiences, once our kids are in the system, these are things like all of the things associated with the workforce. So we know that the adult-child relationship is probably the single most important component of quality that we have. And the things that influence that adult-child relationship are, the working conditions of the adults, the mental health of the adult, the wellness of the adult, the amount of supports that are afforded to the adult, the preparation systems around the adult. And so you heard a lot of that good work happening in DC with both kind of the professional development and social emotional supports, but also thinking about the working conditions and how all of those pieces kind of tie into mental health. So all those things influence kids' experiences. We also think about things like the language of instruction for dual language learners and the extent to which kids with disabilities are meaningfully included across everything, every part of the program. We think about harsh discipline and bias and all of these different components that really influence the experiences that kids have once they come into the early care and education system. I think Oregon actually also did a really nice job kind of honing in on this a little bit more by asking families directly, right? So a lot of the household surveys and really getting at what families are experiencing, what they want, what they prefer across some of that work. And then the last piece is outcomes. And this goes to accountability in our systems. And it goes to what is expected of programs and what is expected at the local level, what is expected of states when we build and we expand early care and education programs. And is equity and closing disparities actually a stated goal? And I see, I know in the DC model, we saw that up front at the beginning of the presentation, really being a clear goal of the system. And so when it's not a clear goal, when it's kind of secondary, or like we might look at that, it gets buried. And I can, checking my time here, I think I have a couple more minutes. But one of the places that we see this really clearly is in discipline, for example. I worked in the Obama administration back in 2014 when we published the preschool discipline policy statement with recommendations on how we eliminate and get rid of expulsions and suspensions in preschool settings and in early childhood settings. And around that time, there was a lot of policy action going on in this space. Congress reauthorized the child care law, which included some language on expulsion and required states to say, to report how they were going to address expulsion. There was a wave of state legislation on this issue with, I think, about half of the states, give or take, passing some kind of legislation that limited suspensions and expulsions in public pre-K settings in particular. And after all of this policy movement, which is huge, I think, considering that policy moves quite slow sometimes, the latest release of data on suspensions and expulsions just in public pre-K, which is what we have at a national level, found that the rate of this practice plummeted significantly. I think it was cut in half between the most recent time point and the one before. But we also found that the racial disparities didn't move at all. They basically stayed the same, and they've stayed the same kind of over the course of time, even though we all know that they are there and they have been published and they've been consistently there over time. But all of the policies, I think that we looked at and that we passed at the state level, at the local level, at the district level, at the federal level, even the guidance, a lot of it was focused on rates, period. So addressing the rate, decreasing the rate, limiting the practice, without enough explicit attention and accountability and monitoring and so on, and standards related to closing the disparities and addressing those gaps. And so really thinking through how across all the outcomes that we look at and that we expect of early care and education systems, how we're really explicit about ensuring that closing disparities where they exist intentionally through policy, through professional development, through systems work is a core part of what we do. So with that, I think I'm going to hand it back to Wei Bing for a few minutes of Q&A.
Great, thanks so much, Chantel. So I haven't seen any questions come in through the chat. So I wanted to give folks who are listening a moment or two, if they wanted to ask a question. But if not, I can just close this out a little bit early. So I did have, hang on one second. I did have a thank you slide along with our funding message. So let me pull that up. And still no questions. This is our PDG B-5 TA Center funding slide. This is our TA Center website for those of you who may be interested in looking at more resources. So thank you again for joining us. Thank you to our speakers and to Chantel for doing that insightful wrap up.